Hi, everyone. How are you? Good to see you. Uh, Not a ton of updates, just a few today. We have 1,508 cases and 54 fatalities. The new testing site is going to be up and running tomorrow morning. And Director Bond, do you want to, you had mentioned that a couple people have already enrolled in the site. Could you chime in? We can't hear you.
Hello, good afternoon. Thank you, Mayor. So we have individuals that started registering. We want to just remind everyone that our testing site does activate tomorrow morning. So if you would like to make an appointment, you can click on our City of New Haven website. Our testing site is there. And so we hope that if you're available, if you have symptoms, please register. It's no cost to our residents, and it's available. You can walk up. So if you do not have a vehicle, you can just walk up and have an appointment for tomorrow morning. We do ask that you register in advance so that we can have you designated for an allotted time.
And just to be clear about that, because the two other sites, Cornell, Scott, and Fairhaven, when we've put out the words walk-in site, people have interpreted that as they can just show up without an appointment. If the press could be clear that people need to schedule an appointment in advance and do not need a car in order to get tested, that would be really helpful. I know that it was reported last night, both in the Board of Education and East Rock Community Management Team meetings, but I also wanted to have Dr. Jalal on the call to share the information about the drop-in site that is designed to support individuals experiencing homelessness and give an overview and then be able to answer any questions. So Dr. Jalal.
Thank you, Mayor. I'll give a brief overview of the drop-in site. Some information, as the Mayor mentions, was shared yesterday. So what we're planning to do is set up a drop-in resource center for our unsheltered and rough sleeper population in New Haven. As folks on the call here are aware, many of our services that we typically offer to our individuals who typically sleep outside and in encampments, many of those services shut down as the pandemic hit. So now we're organizing to stand up a resource center for those individuals. It's going to happen on Blake Field, and it's going to be a pop-up facility Monday through Friday, running from approximately 12:30 to 4. Twice a week, we will offer access to the East Rock Magnet School for showering. And that showering protocol will be supervised, and we won't we would screen folks for any COVID or COVID-like symptoms before entering into the facility. But we do want to make that resource available since there aren't many other places in the city where that can happen. In terms of the services that will be offered, it's primarily envisioned as a public health effort. We want to make sure that those who are in the community and on the streets do have the opportunity to get screened for COVID, and making sure that we catch those individuals and triage them appropriately if they happen to have symptoms, and triage them to testing if they are symptomatic. And so there'll be a health team there. There will also be a psychiatry team there, as well as the provision of food and triage services into housing. So that's the plan for that site. We are anticipated to go live next week. Sometimes there's a few logistic issues that our team is working out with respect to setting the tent up, but the service providers are set to go, and that facility should be operational next week.
Thanks, Dr. Jalal. And I know that you and the team have put in a ton of work to get this site activated. So thank you for that work. And also, I just wanted to take a moment to say how grateful I am to so many people in the community. The fact that people at the East Rock Management Team meeting last night not only welcomed the site, but also offered to volunteer is inspiring, and I really appreciate that. I had one other update, and that is that we were made aware of a potential issue regarding overtime in the fire department. We don't know whether the claim is valid or not, but we of course take every claim like this very seriously, and we're having an internal audit done to ensure there was no inappropriate activity. We're going to put a press release out about this shortly, and we'll keep you updated, of course, on any other developments. Chief Alston, do you have anything to add, or did I cover it?
No, sir, that actually sums it up.
Okay. I don't have any other updates. Do folks have any questions? I'm going to go with Mary first and then Tom.
Hi,
Mary.
thanks, Mayor. So can you, as long as you're going to put a press release out on it anyways, can you talk about the details of the fire department audit?
I don't know if Chief, you want to share any other details of it, or if that pretty much covers it. Is there anything else you can share?
Yeah, no, actually, I'm ready to hit send. So it, to be fair to everyone, those online and offline, I believe that's probably the best way to go. At first glance, I think we're okay, but we welcome an internal audit.
So the details of the charges are in a written press release or concerns?
Yes.
Yeah, but I wouldn't use the word charges.
Okay,
But we were notified of some concerns and are looking into them.
okay. I'll just keep asking questions, and then if you want to say more, fine.
Director Bond's on the call too, and you know how she can keep me from sharing information about it.
This is a little different though.
I did not take a day off, Mary.
I know it. You've been here every day, faithfully. So, I mean, was this concerns brought up by an internal observer or from outside the system? I mean, it's just nice to be able to talk to the chief, I guess, at this point, since he's right here. And
Sure, I have no issue with that. I was made aware by a member, and it was corroborated that there was information out there. We tracked down the information, and we have begun the process of looking through what the claims are. And I believe it's more a matter of discrepancies rather than any wrongdoing, but I want to make sure that we do our due diligence and allow for an independent internal audit from Office of Management and Budget.
And the chief and I talked about this earlier today, and my tendency is always to be more proactive about sharing publicly if we get some sort of complaint before we start to conduct an investigation, rather than waiting until an investigation is done and then sharing things. So I think it's important for folks to know that we don't have all the information about the situation, and wanted to proactively share. It could be valid, it could not be valid.
okay. I just have a question for the head of the Community Services Administration on the setup at East Rock Park. Unfortunately, I wasn't on the call yesterday for the
It's Blake Field.
meeting.
Blake Field,
It's
not East Rock Park.
Sorry, Blakefield. Okay. Maybe just the details of this. That sounds really proactive. And this, you haven't done this before. I mean, this is essentially because there's no shelters. Is that right? Right now?
Well, no, it's not necessarily there's no shelters. The shelters, as you know, we had a strategy decompress the shelters
Right.
and move our population there into hotels. This is for those who inevitably do not either cannot or will not accept the sheltering opportunity that's offered to them, and they're sleeping in the streets or in encampments. Those individuals typically receive services through either soup kitchens or other sort of mobile van type services, or through street medicine teams. And we feel like having a dedicated site where those services can be provided will be important, both from a public health perspective and a humanitarian perspective for these individuals.
Okay.
So correct me if I'm wrong, Dr. Dalal, but the tent site will be at basically where this concrete pad is. Is that correct?
That is correct. The tent will be set up with a concrete pad. There'll be a few tables set up there to the service provider community to provide, to kind of interface with the individuals and provide their services. And again, these providers are used to providing services on the street, so that it wouldn't be a huge change for them. Often they actually go into the encampments themselves to do these interfaces and interactions. So this will actually be a better service delivery model for the service providers in a more systematic way. We'll have coordinators on site to make sure that there's appropriate social distancing happening. Some signage up, reminders about the rules of social distancing. We'll be providing masks to anyone that comes in. So again, we're trying to make this as comfortable as possible for both the individuals and the clients that need the services, as well as the providers that are going to be there.
Right, I know people from probably the Hill, I think, clinic would go to community soup kitchen downtown, regularly basis and kind of check people up medically. So is
That's right. Yeah, it is actually. We are partnering with the Cornell Scott Hill Health Center street medicine team on this.
Okay. These individuals too, I mean, did they, before this, I mean, you're going to offer, access to the school for showers. Do they have that kind of access before? I mean, if they don't use the shelter, they just didn't have that, I guess.
Yeah, I mean, there were various facilities. At least there was running water available at some of the open facilities downtown for cleanups, so bathrooms and whatnot. The Omega Warming Center did have a shower van available when it was open. So there were various places where such amenities were available. But this will make it, have this resource available at least for the time being until we can open up some of these other facilities.
Okay. And again, if this population doesn't tend to use those shelters, I mean, it's not a permanent situation at the park. I mean, to serve them specifically. I mean, there's a lot of encampments there used to be anyways.
That's right. Well, there still are a lot of encampments. There's some anecdotal evidence that there are new people, moving in and populating these encampments. So again, this will allow us to collect some data in that regard as well, just to understand where people are from. Are there new faces? Again, our street outreach and engagement teams are very well aware of the folks who are out in the encampments. And if we see some new faces, that will help us collect some data with respect to whether the reports of new people moving into New Haven as a result of this pandemic are actually verifiable or not.
Okay.
And to be clear, the tent is not for people to sleep in it. The tent is just for, inclement weather for the people that are staffing it.
Okay. And it's not a test site either for COVID. I mean, that's totally that's.
The street medicine team does have the capability to perform tests on site.
Okay.
I'll have to confirm with them whether they're actually going to bring that testing capability here. I know that there's issues with supplies and PPE and whatnot, so I don't want to speak for them, but they do have that capability.
Okay. I have more questions, but I can wait for someone else.
Let's go to Tom. And Tom, it would be great if you could clarify in the New Haven Independent article the language around that. Currently, the article says that there will be testing on site for COVID, and that's not clear.
So it's a possibility, but not definite. Is that the deal?
That's
correct, Dr.
Yeah, happy to. Thank you. Thank you for the update, everyone. Thank you, Dr. Jalal. Dr. Jalal, you mentioned the Cornell Scott Hill Health Center street medicine team. Which other specific partners with the city will be working at the site? And do you have a sense of how many staff members from various organizations will be there on average from this 12 to 4 window Monday through Friday?
Yeah, sure. I can speak a little bit. Some of the details are still being ironed out, so it may change by the time we go live. Another primary partner for us is the CMHC, Connecticut Mental Health Center. They're helping to organize the various outreach and engagement teams that includes their street psychiatry program. They've agreed to provide some on-site support as well as more extensive telesupport as needed. So even if the team isn't on site, there will be an opportunity to do some telehealth or behavioral health services through Connecticut Mental Health Center. Columbus House is also partnering with us. We are we have an on-site coordinator we hired specifically for this purpose, and that hire is happening through Columbus House, and they're also partnering with us on this initiative. And then, of course, the United Way through their CAN Coordinated Access Network, they've also been involved in the planning, and we plan to have some triage capability at the site with respect to more permanent solutions for housing or even hoteling. Again, if we see someone new that we haven't seen before that needs to be on the list for our hotel, we'll put them on that list. If they qualify in some other way for more permanent housing, we'd also get them triaged into that system as well. I don't know the exact number of staff that will be there. I can estimate anywhere between 6 and 8 staff. Again, that may not cover the entire time period from 12:30 to 4 that we mentioned, but for the majority part of the time, I would estimate about 6 to 8 staff will be there at a time, including potentially volunteers.
And do you or the mayor have an updated number as to how many homeless individuals are currently decompressed to hotel rooms in New Haven or in West Haven? And if not, I'm happy to get an update later, but do you know?
Yeah, I'll need to, no, yeah, I'll need to, I don't have an updated number. Whatever I provided last time was probably pretty close to what it is now, but I can, if there's an opportunity to provide an update later, I can get that information to you.
Thank you. And Director Bond, I know you wrote in the chat area where people can call if they want to set up a site or set up an appointment at the Day Street testing site. Could you remind me and listeners just where this testing site will be, like if there's an address or intersection, and what the hours are?
Yeah, absolutely. Thank you. So it's going to be Day Street and Chapel, so the Day Street Park, and it's going to be Mondays through Friday, 8 to 4, starting tomorrow. And so again, they can visit the website that is nhvcovidtesting.com, or they can call if they do not have access to the internet, our public health hotline at 203-946-4949, and we will assist with making appointments.
Just to add to that, Tom, so on the city's COVID website, if people Google City of New Haven COVID, they can find it. There's a pretty clear link if people scroll down to the testing sites. There's 5 testing sites in the City of New Haven now, and each one of them has slightly different hours, slightly different ways of registering. So the team created this web page to allow people to easily get the information. And you'll see that these are the 2 Yale New Haven and CVS sites, the new site here at the corner of Chapel and Day, the site here on Dixville Avenue, and the site in Fairhaven. And you can click on them, and over here there will be information about how people register to make it easier for folks.
Exactly. We want to make sure people have access to testing.
Do you have a sense of what the daily capacity might be at this new Day Street site? I know Fairhaven and Cornell Scott were looking at every 15 minutes. That might increase, but do you have a sense of what that might be at Day Street?
We are averaging about 100 a day as capacity. So we're available for 100 a day. So we're looking forward to, people having this as an additional option that are within this neighborhood to be able to schedule an appointment.
But to the specific question about this site, Director Bond, do you know how many are they going to be able to process 100 tests a day?
Per day. Mm-hmm.
Okay, all right.
And then my last question about this site was that I'd heard, and I apologize if you went over this on yesterday's briefing, but I'd heard that there was going to be a site in the parking lot for the Stop and Shop on Whaley Avenue. Is there still talks of a site opening there, and why did that not?
I can respond to that. So the initial intended site was the Stop and Shop Plaza for this Murphy testing facility. What was holding it up for so long was we were in negotiations with the Greater Dwight Development Corporation, who owns the property and manages it. We were unable to come to an agreement with them, and so we needed to find an alternative site. And yesterday made the decision to go to an alternative site, and that's the Day and Chapel Street corner.
So there are no plans as of right now to set up an additional site at the Stop and Shop Plaza?
Not at the Stop and Shop Plaza.
No, and the plan was to have this site be at the Stop and Shop Plaza. Because that did not work out, because the negotiations with Greater Dwight Development Corporation were not successful, we needed to choose an alternative site that's frankly not very far from Stop and Shop Plaza.
And then, if I may get in one more question before deferring to others. Every day everyone in your team talks about the many efforts that the city is up to in response to COVID, but I wanted to list a few others that I recently learned other cities in Connecticut are up to, and just to hear your thoughts. I read that Hartford city government recently contracted with, I think, a rideshare company or some car service to provide free transportation for people who don't have a car to get to testing sites. And then I also read that Stamford has announced that it will be giving out free masks, I think, over the course of this week at various spots throughout the city. So contracting with for free transportation for people to get to sites, and then free masks Are these initiatives that you all have read about or considered?
Well, so the state has contracted with M7 in New Haven for people to get free rides to the CVS facility. That was something that when we were in conversations with the state about opening up of the CVS facility, we pushed very hard for. We'd actually really appreciate it if the press got information out about this. We've shared it a lot, but not as many residents as we were hoping have used it. And any resident can use M7 by calling 211 after they schedule an appointment at the CVS site. And for free, M7 will take them to the site, get tested, and then take them home. And M7 is also equipped to be able to take people with disabilities. As far as the mask, we've talked a little bit about that, and Dr. Jalal and Director Bond, you're welcome to chime in as well. There's other organizations that have been giving masks out around the state. I know that a lot of masks were delivered to Bella Vista recently by the Masks for Heroes, I believe is the organization's name. One issue with the masks that are given out is that they're often not for long-term use. And I think in general, our preference is that people use cloth masks, cloth face coverings, not surgical masks, because we don't want to take those out of circulation for healthcare workers.
Yeah.
Does that feel accurate?
That's very accurate. I also want to add that what we've been doing at the local health level here in New Haven is assisting home health agencies and other facilities with providing them supplies. And also, for example, our local community health center so they can be able to scale up their testing by providing swabs. So we've been providing some PPE to our local agencies, smaller agencies that have limited supply with PPE. So we've been doing that all along as part of our response to COVID-19.
That's it for me. Thank you very much.
Yeah, thanks, Tom. I'm surprised that you didn't bring up with examples of what's going on in other cities. Mayor Ganem's videos, they're looking sharp. If you haven't checked them out, check them out. Mary, go ahead.
So I had the CVS, I guess, announced, I don't know if it was today or yesterday, but that they're going to have testing at their pharmacies. This is across the country. Have you heard anything about that locally, where they might come into New Haven or Connecticut?
No. Obviously, the more testing we have, the better.
Yep.
So that would be a good development.
Okay. I don't know, this is probably more for the medical people, but one of the labs is also going to start testing, serial testing for antibodies. I don't know, I guess that's probably something for the hospital. But that just came over today too. Maybe back to Dr. Jalal. How is it working out now? I mean, are people, present themselves as homeless? Can they get into hotels? I mean, is there enough flexibility, or another facility hasn't been rented, has it, in coordination with the state?
Yeah, so we have two hotels that the state is paying for, either through contract or through other financial means. There is another facility that's available, but that has not been activated yet. It's not in New Haven, but it's nearby. So again, that's under state contract. We're aware it's available, and we may work with the state to activate it if there's a demand. I'm sorry, I missed the first part of your question.
Well, I think it's probably more for the hospitals. There's
oh, right.
Right, one of the
yeah. I mean, I defer to Director Bond if she has any additional thoughts, but I think with respect to just the overall evidence around the antibody testing, I think we have to wait till the science is in to know what value that is, because we don't know whether such antibodies do confer immunity and how long immunity would last even if it does confer immunity. So I think there's a lot of science that still needs to be done before making any definitive statements on that.
Okay, could I just ask you something else about the hotels? So I think we know the names of the two hotels in New Haven, and then there's the West Haven site also, but then now there's a fourth that's potentially there if people need it.
No, there's one in New Haven, one in West Haven, and then there's a third potential.
So,
Okay.
so there were originally two hotels in New Haven that were being used. Now,
Right.
one of those is no longer hosting anybody. So there's one hotel in New Haven, one hotel in West Haven, and then there's a third hotel that is has the potential, should there be a need, to house more people.
Okay. How would you determine if there's a need? Do you need a certain number of additional homeless people to, I guess, make themselves known?
Right, right. I mean, I think the part of it is this drop-in site will help help understand what the demand for the additional rooms we need is. I think we have an estimate based on our point in time count regarding the number of homeless in New Haven. Of course, we can debate that number because it's only a seasonal count. But we did inform the state with respect to the numbers we anticipated that would need hoteling. Which included not just the sheltered population and the population in the warming centers, but also those who are potentially in the streets that might be served by the hoteling option. Again,
And Dr. Dr. correct me if I'm wrong, but one of the other challenges is staffing.
That's right. Yeah.
That we can't just say to people, go to this site without having support staff on site. And as we shared before, there's a limited number of staff available right now that have history working with individuals experiencing homelessness, because there's a lot of people that may be at risk themselves. And so one of the challenges that we've also faced in activating these sites is having enough people that are able to staff and support the site.
All right. And that staff was coming from the existing shelters before they were.
That's correct.
Okay. All right. Do you know how many people are are taken care of now in hotels, and what the number is that you estimated?
I know Tom just asked that question. I don't have any updates from today. I can check and get back to you with the exact number at the end of the day. It fluctuates a bit because we also in tandem with housing people, we try to move people as quickly as possible into more permanent solutions. So I can get back to you with a number.
Okay, and the triaging for housing that you just brought up now again, that's ongoing. I mean, people in temporarily, I guess, in the hotels, they're being triaged to get.
That's correct. Yeah, there's rapid rehousing programs or rapid exit programs that we screen each of these individuals for and see if they're eligible under those programs.
Okay, all right. So
that effort has really ramped up. The Department of Housing at the outset of this pandemic provided some additional funds for that effort to ramp up. So our partners have been working to get people permanent housing at a higher clip than is typical. Because again, we don't want to have a situation where they're have to be recongregated unnecessarily prematurely.
Right. Well, any statistics you have on that? I mean, your original list, if it's changed or how many are actually in the hotels.
Yeah, I don't think it's changed that much, but I'll get that to you.
Okay. And the partners that are actually bringing the housing in, is that Columbus House? And
that's right. Yeah.
Mainly Columbus?
It's mainly Columbus House, yes.
Thank you.
Other questions? Other questions? Mary, are you asking another question already?
Well, Tom had his hand up.
Let's go with Tom first.
Thank you. Mayor, I know that some local immigrant rights activists are really stepping up pressure on the state to create some kind of undocumented worker relief fund. A few weeks ago, you mentioned that was something the city was considering, providing some kind of direct cash assistance or additional support for a population that has been almost entirely overlooked by all federal relief so far. Is that something that the city is still considering? And if so, what's the latest with?
So a number of things. We've been in communication in particular with Junta and Kika Matos and other leaders in the Latinx community. And we're going to be promoting a fund that they have created to help support rents for individuals in the undocumented community. Additionally, they have recorded a what do you call it? Like a voices of community leaders talking about why it's important to wash your hands and wear a face covering, things like that, that we're going to be playing in the neighborhoods as well. And we're having conversations with some donors, some larger donors, about other ways that we can ensure support of the undocumented community. I know United Way has provided some funding already for cash support for individuals in the community, and we'll be advocating for more of that as well. I also am optimistic and hopeful that the state will play an additional role in helping support financially individuals in the undocumented community, because clearly the federal stimulus is going to be missing a lot of people.
And I'm sorry, you said junta, but is it ULA or junta, or you're working with both, or did you mean junta?
I meant junta, that we've had conversation with junta, but junta is playing the lead, but ULA's also been in conversations. There's a number of different groups that have been in these conversations.
Great, and that's it for me. Thank you. Thank you.
Mary, can we do one more question?
Yeah, just I don't know if there's any updates on the nursing homes and.
Not since yesterday of the numbers that I reported. So no changes. Maybe tomorrow I'll provide another update.
Okay. And on the immigrants, you know, the immigrants, I know they've ramped up and they're trying to have the Connecticut government model what California just did with a public-private partnership to provide direct assistance to immigrants. The city, I mean, the city's not, is it in a position to actually provide that kind of, actually sending people money to live on? Is that?
I think that would be a challenge for us. As folks know, we're facing currently a $15 million deficit for this current fiscal year, and we're working to mitigate that deficit. It's very difficult for us financially to be able to provide additional money. We're exploring options, but it's obviously a challenge.
Okay. Thank you.
All right, thanks everybody for your time, and we'll see you soon.